Turning to the situation in Gaza, which shows, and the horror of the situation in Gaza, which shows no signs of stopping. According to the Gaza Ministry of Health, over 46,000 Palestinians have now been killed in the Gaza Strip since October of 2023. Most of these people were women and children. Tragically, 8 newborn babies died of hypothermia in the last month alone. Hostilities are continuing with the relentless operations by the Israel Defense Forces, causing mass casualties and widespread destruction. The conditions are particularly alarming in besieged North Gaza, where the movement of humanitarian personnel is heavily restricted. Rocket fire by Palestinian armed groups towards Israel also continues, endangering civilians there as well. The Secretary General again strongly condemns the widespread killing and injury to civilians in this conflict. He calls on all to respect international humanitarian law and demands the protection of all civilians. Civilians must be protected. Civilians must be respected at all times, and their essential needs must be met. There must be an immediate ceasefire and the immediate and unconditional release of all the hostages being held in Gaza. And just to dig down a little deeper, our humanitarian colleagues are telling us that the hunger crisis across the Gaza Strip continues to worsen amid critical supply shortages, severe access restrictions, and violent armed looting. In central and southern Gaza, OCHA reports that as of Sunday, our humanitarian partners had exhausted all supplies at their warehouses at a time when Israeli authorities continue to deny most requests to bring food assistance from Erez West crossing to areas south of Wadi Gaza. Meanwhile, about 120,000 metric tons of food assistance, enough to provide rations for the entire population for more than 3 months, remain stranded outside of Gaza. Our partners warn that if additional supplies are not received, the distribution of food parcels to hungry families will remain extremely limited. More than 50 communities' kitchen, providing over 200,000 meals a day to people in central and southern Gaza, would also be at risk of shutting down in the coming days. Our World Food Program colleagues tell us that as of Monday, only 5 of 20 bakeries supported by WFP are still operational across the Gaza Strip, all of them in Gaza Governorate. To stay up and running, these bakeries rely on continued fuel deliveries by partners in the southern part of Gaza. Our humanitarian colleagues warn that the lack of fuel to power generators is also crippling Gaza's health system, putting the lives of patients at risk. Despite ongoing challenges, we and our partners are working to reach people throughout the Strip with critical support. Across Gaza, between the 22nd of December and yesterday, our partners report that some 560,000 people received primary and secondary healthcare services. Meanwhile, ongoing attacks and hostilities in North Gaza Governorate have severely disrupted healthcare services for survivors who remain there. Access to Al-Auda Hospital for Jabalia, the only hospital in North Gaza that is still partially functioning, is extremely limited. OCHA reports that Israeli authorities continue to deny UN-led efforts, including the most recent attempt yesterday to reach North Gaza Governorate. Across the Strip yesterday, out of 15 coordinated humanitarian movements, the Israeli authorities facilitated only 5 missions, while 4 were impeded, 3 were denied, and another 3 were canceled due to security or logistical challenges. Turning to Syria, I think you heard extensively yesterday from Tom Fletcher, humanitarian chief, about the situation on the ground. He spoke at the council. Our colleagues in Syria today tell us that about the immense challenges that remain in the country. Our humanitarian affairs colleagues report that restoring the water and electricity supply, among other basic services, remains challenging across the country due to insecurity and infrastructure damage. In Aleppo, the Tishreen dam remains non-operational since it was damaged in a conflict about a month ago. Clashes continue in the area, cutting off regular water and electricity access for more than 410,000 people in the cities of Memjib and Kobani. OCHA also tells us that ongoing hostilities in parts of Aleppo governorate are resulting in reports of civilian casualties, damage to infrastructure, and, of course, disruption to aid operations. On the health front, we and our partners continue to support the responses, including the delivery of medicine, trauma kits, and vaccines, but health remains a huge challenge across Syria. Many health and nutrition facilities in the northwest of the country remain closed, with many having been severely damaged due to the shelling in recent months, while others have just run out of money. Meanwhile, in the northeast, medical mobile units are facing staffing shortages due to the lack of health workers. Our health partners are also reporting critical needs for pharmaceuticals and medical supplies. And as you'll recall, nearly 15 million people require humanitarian health support, and close to 13 million people are still facing acute food insecurity. We and our partners continue to help as security and logistical conditions permit. From Yemen, today, our special envoy for Yemen, Hans Grunberg, concluded his visit to Sana'a. During his discussions there with senior political and military officials, the special envoy stressed the importance of national and regional de-escalation to foster an environment that's conducive to dialogue. He also urged the need to agree on concrete actions to pave the way forward for a political process to achieve sustainable peace and stability across Yemen. In his discussions, the special envoy strongly urged Ansar Allah to release immediately and unconditionally the detained personnel from the United Nations, NGOs, civil society, and various diplomatic missions. He echoed the Secretary General's message that arbitrary detentions are unacceptable and they constitute a violation of international law. Just to remind you, a total of 16 of our colleagues remain detained, and their whereabouts and status are still unknown. While he was in Sana'a, Mr. Grunberg visited the family of one of those detainees. He expressed solidarity with them and acknowledged their shared anguish and urgent need for their loved one's release. We reiterate once again that those detained must be treated with full respect for international humanitarian law and human rights law, including allowing them contact with their families, their legal representations, and their organizations. In close consultations this morning in the Security Council, Rosemary DiCarlo, our Undersecretary General for Political and Peacebuilding Affairs, briefed Council members on Libya, most specifically on the work of the UN political mission in Libya, UNSMIL. She told Council members that UNSMIL had begun work on its initiative for an inclusive intra-Libyan and multi-track political process. UNSMIL has continued consultations with Libyan stakeholders, including women's group and youth groups, to ensure that their constructive engagement and input into the process. Overall, Libyan stakeholders have expressed broad support for this initiative, and she urged Security Council members to continue to support the work of our political mission in Libya. And also yesterday afternoon, Khaled Kyari, the Assistant Secretary General for Political and Peacebuilding Affairs, briefed Security Council members on non-proliferation in the Democratic People's Republic of Korea. He said the launch of yet another ballistic missile by the DPRK on January 6th is of serious concern. Mr. Kyari added that the DPRK's persistent pursuit of its nuclear and ballistic missiles program continues to undermine the global nuclear disarmament and non-proliferation regime. It also escalates tensions and contributes to further isolation of the DPRK from the international community. Mr. Kyari said we continue to call on the DPRK to fully comply with its international obligations. And turning to Ukraine, the Office of the Coordination of Humanitarian Affairs condemned yesterday's deadly attack in Zaporizhzhia city. Authorities reported dozens of casualties and a glide bomb struck vehicles, a tram, and industrial facility. The humanitarian coordinator in Ukraine and resident coordinator Matthias Schmale said the attack marked yet another intolerable killing and injuring of civilians in the country. Humanitarian partners and first responders in Zaporizhzhia mobilized emergency assistance, including first aid. Humanitarian workers also helped transport the injured to hospitals, clear debris and provide psychological assistance to people impacted by the attack. Hostilities in other frontline areas of southern and eastern Ukraine yesterday also damaged homes and energy infrastructure, further impeding people's access to basic services, especially including the Dnipro and Kherson region. And lastly, letters were sent out yesterday. And you know what that means? That means, what are we asking in those letters when we send out letters to member states? Money. Money, 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 money. The assessment letters for 2025, regular budget dues have been sent to member states following the approval on Christmas Eve of the budget of $3.72 billion US dollars. As we've been told this morning, that 5 member states already answered our letters with cash. Not with checks. Yeah, sorry. No suitcases of cash were transferred, at least none that I know of. We're delighted to thank Equatorial Guinea, Kazakhstan, Papua New Guinea, Senegal, and Kuwait for their contributions. We take the opportunity to invite the remaining 108 member states to pay by the 6th of February if they want to be included in the True Honor Roll.